Christmas is coming up, which means the season of gifting is upon us. Even if you don't celebrate, there's no reason not to spoil yourself. Dossier's best sales of the year are live now. You can enjoy up to 40% off site-wide. If you're looking for a more masculine scent, my favourites are Woody Green Apple, inspired by 1 Million, and Aromatic Star Anise, inspired by Sauvage. Check out the website with the link in my bio, and happy shopping. Hi, come in. Take a seat, make yourself comfortable. Okay, thank you so much for coming in today. My name is Lila. I am one of the practicing nurses here. I am currently in training. Yes, and you are here for the head, eyes, ears, nose and throat exam. Fabulous. Well, again, thank you for being part of my research studies. I'm very appreciative for you taking the time out of your day to be able, well, for me to be able to do this. Perfect. So, may I just confirm your name and date of birth? Okay. Here you are. And may I just make sure that matches your wristband? Perfect. Now, before seeing me, you should have gone through one of our other nurses here on site who would have taken your blood pressure, heart rate, some bloods. Yes, and did they also go through the medical checklist form? Okay, good. So that was just confirming we have no medical diagnoses or injuries that could affect today's exam. Super. Okay. Do you wear glasses at all or contact lenses? Okay. No worries. Now, you will have to forgive me where I am in training. I do sometimes need to refer to my notes that I do have here. Yes. If you have any questions along the way, please feel free to ask. I'm more than happy to do my best in answering that for you. Are you feeling fit and well in yourself today? Good. Okay, so now I'm just going to pop some gloves on and palpate your skull and scalp, checking for any masses, lumps, bumps, abrasions in the scalp itself. Feeling around the back of your head here. Okay, I'm just going to go through and make some parts in the scalp just to make sure everything looks okay visually as well. Okay, that is all good. Okay, I'm just going to check your facial symmetry. Now, nobody has a perfectly symmetrical face. Everybody is symmetric in some way. For me it's my nose where it's been broken, but yours looks as symmetrical as it can be. Yeah. Now I just need to check your facial expression, so if you can do a nice big smile for me. Can you smile with the mouth closed as well? Can you raise your eyebrows? Super. Can you stick your tongue out? Can you frown? Can you put your tongue from cheek to cheek? Good. Okay. I do just want to check your neck range of motion. I will support you when we do this, so don't be concerned that we're going to push you too far. So I'm just going to move your neck this way to start with. Lovely. And then we'll move you back to centre and the upper way, okay? Right. Everything seems good there. No pain at all when I'm doing that? Alright. Just going to palpate your lymph nodes, but I'm also going to have a look at your thyroid, or have a feel of your thyroid gland whilst I'm doing this as well. Okay, you're welcome to close your eyes. I'm going to be touching your face. See any obvious signs of deformities or trauma? Is there anything you would like to tell me about that may not be obvious? Just going to do an assessment of your temporal arteries. We're now going to move on to the eyes. I'm just going to begin by just having a little look at your pupils here. Okay. No obvious signs of any deformities. Going to inspect the external eye structure, so if you can close your eyes for me, I am going to use a torch just to make you aware. Okay, we have equal hair distribution on your lashes, so that's good. No signs of any dry skin or sore patches. Now I'm just going to take a look at your conjunctiva and sclera. So if you open your eyes for me, and I'm just going to pull down on your lower lid. Going to see how your pupil accommodates to light, so I'm going to just bring it in and out of your vision. If you want to focus just behind me. Perfect. I'm just going to hold my hand in the center of your face, shine the light in one eye and look in the opposite, okay? That there for a moment. I'm just going to hold this chart up. I am going to point to a number and I want you to tell me which number you see, okay? Now if you can focus on my finger here and just follow it, okay? Perfect. Then I'm going to test your peripheral vision, so do let me know when you see. Okay. Perfect. I'm going to come from above now, so you tell me when you can't see. Okay, and now from below, so you tell me when you can see. Okay. Okay. If you can follow my finger again with your eyes and not your head. If you could just do me a favour and look up. You can look to your right. You can look down. Again, I'm just going to pull on your upper lid this time. And then look to your left for me. Right, that is the eye portion of the exam all done. I just want to take a little look at your ears now. So, ears seem equal in size but also position. Signs of any discharge. I'm just going to take a little look in your ear here. Okay, and the other ear here. Perfect. I want to make some soft sounds beside your ears and you tell me which one it is. Which hand it is, okay? So either your left or your right. Yeah, an example is going to sound like this. Okay? Good. The ears are the nice, easy part of the exam. Yeah. Okay. So, just gonna have a little look at your nose now. Just before I start messing around with your nose, some people find that when your nose is touched, it can cause it to become blocked. So if you can just hold a finger on one nostril and take a nice deep breath in and out. And then the other one. Super. Just going to have a little look side, checking for any polyps or deviation. Okay. No sign of any discharge. Again, I'm just going to have a little look at your septum position. Okay. Good. And I'm just going to feel down your nose there. Okay. Obstructions. Can you just take some breaths for me? Just in your regular breathing pattern. Good. Okay. Now we're moving on to throat. I do need to just have a little look inside your mouth, so we're inspecting the oral cavity. I'm just looking at your lips. They are nice and moist, so there's no signs of like dehydration or anything like that. Yeah. Just put my other glove back on, excuse me. So if you can open your mouth for me. Just going to take a little look inside your mouth to begin with. Are you keeping up with dental visits? Good. Just having a little look at your teeth. Excuse me for just manoeuvring your lip here. I'm also having a look at the gums whilst I'm here, so again, excuse me for moving your lip. Okay. Now I'm just going to check your tongue here, so if you stick it out for me. And how's your tongue mobility? You just move it around. Good, that's perfect. Right, tonsils. If you can, again, stick the tongue out and go ah. Good, tonsils are fine. Now this one isn't very nice, but I do need to check your gag reflex. Yes, so I'm just going to use a disposable wooden stick and just pop that into the bag. There we go. Yes, it's not very nice, that one, I do apologise. If you are able to just say the words light, tight, dynamite for me. Lovely. And now I just want to have a look at your swallowing. So I'm going to just hold your throat and ask you to swallow. Good, and again for me. Are you able to start to swallow but hold it? So it would kind of be something like yeah, okay. Good, that's fine. Okay, swallowing is all okay. Oh, just one last thing, I want to have a little look at the jaw. I'm just going to place my hands on your muscles here. If you can open your mouth nice and wide. And just keep repeating that motion. Good. Right. So that was everything we needed to check as part of the exam today. There is nothing at all that you need to be concerned about. Let me just make this note here. Were you offered an incentive to take part in the studies? thank you very much for doing so. I appreciate you being here today. Okay, so that is us all done. Again, I've probably thanked you 1,000 times, but thank you for allowing me to do an examination on you as part of my studies. And maybe one day you'll be seeing me as your primary care physician. You're very welcome.